What are the main drivers of IVF success? The answer might surprise you. You might think that the answer is obvious. Clinical factors, female age, quality of the egg and the sperm that are being used to create embryos, and of course, clinical decisions by the physician team, everything from the treatment plan to the stimulation protocol. But there's a third major factor that is often overlooked, and that's the IVF lab, the protocols being used, the quality control systems, the level of experience, and the volume of procedures. It can be really confusing to know exactly what to look for and what to prioritize when choosing a clinic. But the truth is that what happens behind closed doors, closed lab doors, is just as important, if not more important, than anything you see on your patient portal. And there's data to back this up. A recent US-based cross-sectional analysis looking at high-performing with high success rate IVF centers involving women under the age of 37 found that there were several commonalities when it came to certain clinical and lab practices. Interestingly, they found that these centers that were doing quite well in terms of their statistics consistently used stimulation protocols that relied on both a combination of FSH like gonal F or follistim and LH, so using combinations of FSH and LH in the form of Menopur. They also found that these clinics with high success rates mainly use intramuscular progesterone as their form of progesterone supplementation in medicated prep for FET cycles. Now, I will say internally at where I work, and we do a high volume of transfers, we don't really see a difference between IM intramuscular progesterone shots versus using a combination of oral and vaginal progesterone. But I think the point here is that these are clinics that consistently gave a sufficient amount of progesterone. And this is why it's important to ask questions like, how are progesterone levels monitored? Are they monitored before the FET? Another common feature of programs with consistently high success rates was that they performed all embryo transfers under ultrasound guidance. Now, this is a must, and it would be shocking to me in 2025 to learn of a program that's not using ultrasound guidance, but there are places that have traditionally just done it by feel. And you don't really know exactly where the catheter is, and there's a multitude of studies that have shown superior success rates when ultrasound guidance is used to perform the embryo transfer with the most precision possible. And when it comes to what these highly successful programs were doing in their lab, across the board, they were vitrifying their embryos using the most up-to-date form of technology for freezing, and they were freezing them at the blastocyst stage. These programs consistently used benchtop incubators with low oxygen conditions to culture the embryos within, and they maintained a tightly controlled lab environment. Think HEPA filtration, positive pressure airflow, gas filters, and using heated microscope stages so that you're keeping the embryos in an optimal environment even when they're being removed from the incubator to be handled and observed under the microscope or to undergo biopsy, for example. Strong communication and having a consistent workflow to go between both the clinical and the lab teams were paramount, along with having really experienced embryologists and doctors at the helm managing each step. This type of study isn't new. There was actually a similar publication that came out a decade prior that evaluated the top performing clinics and found that they consistently did a thorough workup evaluating ovarian reserve, uterine factors like endometrial defects and other types of problems like hydrosalpinx. They also all performed ultrasound guided embryo transfers and used a mixture of LH and FSH in their stimulation protocols. They also found that programs that practice blastocyst transfer almost exclusively tended to have better success rates. So what's the takeaway here? That IVF success isn't a gimmick. It's not one shiny tool or trend. It's about being consistent, collaborating, paying attention to details, and having an exceptional lab team that monitors the lab environment and maintains it very carefully. And there was also another study with a newer concept from UC Berkeley that showed that IVF clinics that are part of larger networks or chains tend to have better outcomes than independent clinics. Why? Well, the thought process is that these systems might have better infrastructure, more oversight, more opportunities to standardize their care and what works best, and ultimately this can benefit the patients. So when you're trying to decipher which clinic to go to, look beyond the marketing on their website. Ask about what they do in their lab conditions. How many cycles do they do per year? Ask about how they communicate between doctors and embryologists. Because in IVF, the success story doesn't just happen in the exam room or across my desk in my clinic. It starts in the lab.